Remember, you exist as a three-dimensional face. It is not 2D, it's not just what you see in the mirror, it's not just what a photograph takes of you. And I don't want you to be obsessed with every single angle because I can take it apart. And here's the thing, there are many options. Lips used to be a huge thing that everyone would fill. It was looked at in isolation. Nobody looked at it with respect to the rest of the face. And that's why lips got really blown, really big, and they were out of balance with the nose and the chin. And then what happens? And then projection is actually calculated or thought of in many different ways. There's a lot of these antiquated ways that we look at, how far a nose should stand out or how far lips or chin should stand out. I want you to not be obsessed with every single angle because I can be obsessed with every single angle of your face. And this all comes down to the many different ways that we can balance all the proportions on your face. So remember, you exist as a three-dimensional face. It is not 2D, it's not just what you see in the mirror, it's not just what a photograph takes of you, but you're a 3D person. And so while there are facets of your face that may bother you a little bit, for example, the projection of your nose or how much your lips are full, the purpose of doing balancing or proportional treatments are to give you the optimal result no matter the angle. And I don't want you to be obsessed with every single angle because I can take it apart. And here's the thing, there are many options. So the first, in my opinion, and the easiest one to do, the one that gives you the biggest bang for your buck, is fat grafting or regen grafting, because I can put fat in small parcels in different areas, one to provide volume, one to improve darkness, one to improve skin quality, and then to plump and enhance particular areas. Now, it's easy to do, it can be done in the office, and then projection is actually calculated or thought of in many different ways. There's a lot of these antiquated ways that we look at, how far a nose should stand out or how far lips or chin should stand out, but these are sort of not used anymore. Basically, it is just proportions to the rest of your face. So I look at your side profile, I look at how your lips, chin, and nose line up, but I also look at contours and shadows because contours and shadows actually make a huge difference in the overall look. So for example, if you have a nice highlight from your temple down to your cheek, but you're losing some volume underneath or there's a shadow there, then that might be something that we optimize to subtly soften that area, but not actually make a dramatic change. So while you might be focusing on particular things, facial balancing actually is to focus less on every little minute detail, but to improve the overall picture, just to overall enhance everything on your face so that you look and feel your absolute best. It's going to be hard for people to specifically know what you had done, but they'll notice that things look better. That's the goal, right? We want it to be undetectable. We want it to be softer. We want you to look just like you, but the days of sort of that overblown filler look, those are over because there's so many options in our tool belt to get you the best result. So the first way to think about this is what you want in terms of your goal. If your goal is the nicest, most balanced, appropriate way that you don't have to significantly maintain, surgery tends to be that way. So although there are risks associated with surgery and they are low, it's still something for you to think about. But what I look at when I look at side profiles or even 3/4 views, a rhinoplasty is a great way to think about proportions, right? We're looking at the rotation of the nose, which is how much the nose is turned up. We're looking at the projection of the nose, how far it stands out, and a whole bunch of other things, including how wide it is, how narrow it is, the top of the nose, where it starts, all these things that are subtle that actually change the way that you look. The next part of that, of course, is the lower face, right? Lips. We don't want to just overinflate your lips because they're going to make them look ducky and stand right out. But proportionately, does this mean that a lip lift is going to look more natural? Or does it mean that a small bit of volume looks good? I actually have a lot of patients who are bothered by the thinness of their lips, and I think proportionately their lips look fine. I wouldn't do anything to them, but sometimes it may require a little bit of softening around the chin. That's the next part of the face, the lower third. So chin implants, chin shadow filling, adding some volume to the lower part of the jaw, all of these can improve overall proportions. Now, the thing that I really want to cue you in on is you're not specifically trained or even have the eye to see all these minute things, nor do I expect you to have that. So what I would say the big part is that toolbox that we have, which is filler, fat, surgery. There's so many different options. Come in with what your concerns are. We'll talk about the entire picture. I'll minutely pick apart your face because that's what you've asked me to do. And I'll give you all the options available. Goals are really important. How much risk you're willing to take is also important. And how much treatment and maintenance you want to do is also the next part, because sometimes there's one and done and sometimes there's long-term maintenance. I can't fill in your chin shadows repeatedly with fat. I mean, I can, but that's probably not the easiest thing to do. Filler might be the way to go, but we'll talk all about those. One of the ways that people have sort of gotten away from this overinflated look is focusing on one body part. So lips used to be a huge thing that everyone would fill. It was looked at in isolation. Nobody looked at it with respect to the rest of the face. And that's why lips got really blown, really, really big, and they were out of balance with the nose and the chin. And then what happened? People started overfilling their chins. They ended up with witchy chins. They ended up with the chins that just looked overfilled. And so the balance part starts from day one before you start any treatments at all. It's getting that consultation and what your goals are. And so once you have that down, then we can sort of fine tune things, but subtlety is super important. That doesn't mean subtlety is less treatments or less volume or less invasiveness. It comes down to your ultimate desired goal and what's going to keep you looking the most natural. I cut people off all the time if I think they've had too much fat or too much filler or too much whatever. But the balance part's super important because some of it's this undetectable sort of intangible thing that makes you just look softer and more natural. So I would say when we're looking at things, yes, you should focus on what bugs you, but we'll talk about your entire face because the lips might not even be an issue at all. They might be proportion. And remember, some of this is subjective. A lot of patients, like I said, who think that they have really small lips, who really don't. And they're bothered by the appearance of their lips, the thinness of their lips, but it's so in proportion with the rest of the face that it just does not require doing anything for it. So let's do a case highlight real quick. This is just really exemplifying how surgery can optimize that facial balancing. So this patient was really concerned about her nose. That was her main focus. And the thing is that she doesn't have a bad nose. It just wasn't in the contour she liked. It was downturned and she had a bump. Totally understood all those things. It's a relatively straightforward nose. But the thing to remember is she has a very small chin and a little bit of fat under the chin, only because the chin and the jawline are just smaller. That's going to make that area look fuller. So we talked about a rhinoplasty in depth, but what I wanted to sort of drive home with her is that in order to get the best optimal result for her full face, either a chin implant or filler or something should be done around the chin with a small amount of liposuction to give you that nice contoured, more balanced look. And of course, I think when you're going into a consultation, there's always this kind of like, do we recommend things that you're not bothered by? Do we even recommend things that you're not seeing? And while I hate doing that, it is part of my job to say, these are things that I think will optimize your results. They're by no means necessary. I'm not saving your life. But I think in this case, it really highlights what's going to look the best. In isolation, no matter how you look at it, her nose looks better, it looks softer, it is something that she's happy with. But I think when you think about the overall picture, how she's going to stand in photos, overall how her neck is going to look with things just softer, that's the key piece that I think is actually more beneficial, you could argue, than just doing her nose or doing her nose at all. Because the focus of facial plastic surgery is to bring attention back to the eyes, to balance the face, to make sure things just look in harmony. If you saw her down the street, if you saw her in person, you wouldn't know she had anything done. That's the other key piece of it. It shouldn't look detectable. And these are not treatments that filler, lasers, any skin tightening treatments can accomplish. This is what is required surgically, and it requires zero maintenance from here on out, other than doing skin treatments and wearing sunscreen. This doesn't require any optimal upkeep.